Good evening, ladies and gentlemen. Today it is a great honor having with us at the studio of CNN Greece a distinguished member of the European healthcare sector, of course not only, Dr. Hann's Klúge, the WHO Regional Director for Europe, with a lot of experience, more than 25 years of experience in medical practice and public health in numerous settings around the world. Dr. Klúge, it is a great honor for us to share with us, to the Greek audience and to European audience, your precious experience.
Thank you so much. Ευχαριστώ πολύ.
Παρακαλούμε. I'd like to start with the war in Ukraine and the mobility of the refugees. And you know, all the scientists are talking about the mobility and how does it affairs the public health problems due to the war. What is your opinion?
So I would say there are two sets of issues. So first and foremost is, of course, the very acute situation in Ukraine itself. I have about more than 70 staff in the country working with the Ministry of Health to try the best possible to ensure access to health services. We are sending in a lot of life-saving medical supplies. To some affected areas like Mariupol, it remains very, very difficult. We also see that there is an enormous displacement internally in the country to the west of the country, for example, to Lviv, where the hospitals are overloaded. And what is really terrible are the attacks on the healthcare facilities. This is a red line. Attacks on health facilities, health workers, ambulances is a serious breach of international humanitarian law. WHO has a special system to verify such attacks because there's a lot of disinformation as well. And unfortunately, more than 80 such reports are verified. So WHO is calling for an immediate stop of attacks on health facilities. Then there is also the situation outside of Ukraine. I have been visiting myself Poland, up to the border of Ukraine, Moldova, Czech Republic, and there are about 4 million refugees from Ukraine with complex health needs. First and foremost, a lot of need for psychosocial support, mental health. People have been ripped apart from their families. Most of the refugees are women alone with children, leaving the sons, the husbands behind. They have seen atrocities. This will have a long-lasting impact on mental health. Hence, so important that we opened an office on quality of care, including on mental health for children in Athens, thanks to the strong support of the government. But there are also health needs for chronic diseases. People have hypertension, high blood pressure, high sugar level, cardiovascular diseases. And then there is still a burden of infectious disease. We shouldn't forget that every year there are about 22,000 patients in Ukraine developing tuberculosis. 1/3 is what we call multi-drug resistant tuberculosis. We had about, before the war, 130,000 patients on life-saving antiretroviral treatment for HIV infection, of which 2,700 children. So it's extremely important that those treatment regimens are being continued in the neighboring countries.
I see. The situation is indeed very severe. And as far as I remember, at your written interview to me, you had mentioned about the problem with the low vaccination rate. It is very low, dangerously low, isn't it? Isn't it?
Absolutely. Actually, about 2 weeks before the war started in Ukraine, I myself was in Kiev. I had a lot of interaction with the Minister of Health, Minister Lashko, with the Prime Minister, and we were discussing the vaccination as a matter of priority. First and foremost, the COVID-19. Only 1 out of 3 Ukrainian people eligible for vaccination were vaccinated. But also the routine immunization. Actually, what we discussed at that time were particularly the need for mass vaccination of children due to the outbreaks of poliomyelitis. And then, third component, if we speak about immunization, is that in any emergency, we really need to put attention to measles. Before the war, about 80% of the population was vaccinated with measles, which is not high enough for the population to be safe. And in some cities like Kharkiv, we know that it's less than 50%. So both the COVID-19 and the routine immunization. When I was discussing this with the Minister of Health, he was telling me, Hans, I know about this, but after 2 terrible years of pandemic, the health workforce is really exhausted, also mentally, and now on top is the war. So there is such a need for Europe, for the global community to support Ukraine. Now there is the war, with really a terrible situation, and we don't know what will be in the future. And that's why I really want to express my deepest appreciation to Prime Minister Mitsotakis, Minister of Health Pleuris, Deputy Minister Rapti, with who 2 weeks ago, I myself was in Athens. We opened the Office on Quality of Care and Patient Safety with a component on mental health care for children. 150 million people in the region have some kind of mental health condition, and only 1 out of 3 people with depression receive the care they need. So we need to build mental resilience, and that's what the office in Athens is going to do.
You're absolutely right. We have a second pandemic, mental health pandemic, between the pandemic COVID, and this is a big problem that we are going to face it the next years. Dr. Klúge, I'd like to ask you about the post-pandemic era. How you see the future and how can we build resilience, as you mentioned, and how can we prepare for a next pandemic?
So first, to prepare for the next pandemic, I would say that there were 2 big challenges. One is the alert system. Several countries did not pick up the virus quick enough. So we need to equip the countries with a real-time alert system so that health systems pick up very quickly a threat, a virus, or some problem in the wastewater, or antimicrobial resistance or climate change. So these alert systems. For this, the WHO Regional Office for Europe is going to establish a pan-European network of Center of Disease Control. The second challenge is that even when the countries were alerted, it took too long time before there was political action. And that's why we need to continue to work with heads of state, heads of government, and the idea is to establish a pan-European Health Threat Council to boost policy coherence. Now, on the health system itself, the key issue is a strong primary healthcare system. With mental health specialists, with social workers, we need to bring health and healthcare much closer to the communities. This is to be better prepared for the future.
I see. You mentioned in the beginning of our conversation that you love Greece. So I'd like to ask you now, how do you see the management of the pandemic by the Greek government? And not talking about politically only, you know.
Well, first and foremost, you're absolutely right. I was telling when we had a chat that Greece is very close to my heart. It's such a beautiful country, very committed health workers and people. The people are very resilient because I had the opportunity to work hand in hand with the Greek politicians, the Greek specialists, the Greek people during the financial and economic crisis, which was very, very tough. But from the crisis, the Greek people built more unity, and this has very much impressed me. Now, on the management of the COVID-19, as I was telling Prime Minister Mitsotakis and Minister Plevris when I was recently in Athens, Greece managed to walk a very fine line. Because on one hand, the countries needed to protect the health of the population with strict measures. At the same time, politicians had to keep the economy of the country running, and we all know, for example, for Greece, how important is the tourism sector, including health tourism. And this is a very fine line, and there Greece has done really a great job, but also on the vaccination covers in Greece compared with many countries, particularly for the elderly people, but also for the booster, is really very, very high. Of course, no any country in the world was prepared for this pandemic. But again, Greece took advantage to introduce some innovations, for example, the electronic prescription, the e-diagnostic tests. So there are a number of very good innovations which we are documenting. And for the future, Greece to do what I advise all other countries is to further strengthen the primary healthcare system, which started in fact a couple of years ago, upskilling the competencies of the staff and increasing the prestige of the primary healthcare practitioners and working multidisciplinary with social workers and mental health workers.
You are very clear, absolutely. So, Dr. Hans Klúge, I'd like to thank you so much for all your efforts and for being with us today. I repeat again that it is a great honor having you with us today at the studio of CNN Greece, and really we do appreciate. I wish you all the best in achieving your goals.
I will be you today and every day in the future. Ευχαριστώ πολύ.
Παρακαλούμε.